Welcome to the Saul's Newsstand News Review for February 22, 2019. The Hill reports, Florida GOP governor working with Trump to import cheaper drugs from Canada. Florida Governor Ron DeSantis on Wednesday proposed importing cheaper prescription drugs from Canada into the state and said that President Trump had given his support to the idea. The announcement from DeSantis at a press conference on Wednesday represents a potentially major step in bringing down the cost of drugs and one usually associated with Democrats. Significantly, given that state action would require federal approval to take effect under a 2003 law, DeSantis said that he personally spoke to the president over the weekend and that the president said his administration would approve the move. Spokespeople for the White House did not immediately respond to requests for comment or to confirm President Trump's support. If President Trump were to approve drug importation, it would be a major step that would buck the traditional Republican position in the pharmaceutical industry, which strongly opposes the idea and warns that there are no safeguards to ensure imported drugs are safe. Trump has railed against high-cost drugs and supported drug importation during the 2016 campaign, but has since backed off the idea. The Washington Examiner states, rural hospitals face widespread closures. 1 in 5 hospitals in rural areas are at risk of closing despite being vital to their communities, according to a new Navigant consulting study released Thursday. The hardest hit regions would be the South and the Midwest, including Mississippi, Alabama, Kansas, Georgia, and Minnesota. Southern states have higher uninsured rates than the rest of the country, according to the Kaiser Family Foundation research, making them particularly vulnerable. David Mosley, one of the co-authors of the study and a managing director at Navigant, said, "Our analysis shines a new light on rural hospital crisis that must be addressed and could significantly worsen with any downturn in the economy. Local, state, and federal politicians, as well as health system administrators, need to act." The Navigant study shows that 64% of at-risk hospitals are essential to rural communities. These rural hospitals are struggling in part because of low population growth in these areas, which contributes to an excess of inpatient beds and makes it harder for hospitals to get capital to upgrade their technology. And finally, USA Today advises why you want to file for Social Security and keep working. Social Security is an important source of income for millions of seniors, so it pays to get the most money possible out of these benefits. For some people, that means holding off on Social Security past full retirement age, or FRA, to accrue delayed retirement credits that boost benefits by 8% annually. You're eligible for those credits until you turn 70, so if you're looking at an FRA of 67, you have the potential to increase your benefits by 24%. But you don't actually need to hold off on claiming benefits to snag an increase. Believe it or not, there's one thing you can do to boost your benefits after you've already filed for them. Keep working. Your Social Security benefits are calculated based on your 35 highest years of earnings. Most people, however, earn less early in their careers than later, and while that's partly due to the fact that the premium for entry-level workers isn't what it is for experienced employees, it's also because inflation causes wages to naturally rise over time. When you continue working later in life, you're generally able to replace a lower earning year with a higher earning year, thereby boosting your benefits as a result. But you can employ this strategy even if you decide not to wait as long as possible, age 70, to claim Social Security. We would encourage you to read the full article by clicking on the link in the description below. And that concludes your Saul's Newsstand News Review for February 22, 2019. For more political news faster, visit saulsnews.com.